So my name is Dr. Chaya Murali. I'm a pediatric geneticist and postdoctoral research fellow. I see patients over at Texas Children's Hospital, and I do my research at Baylor College of Medicine. And my research is generally interested in the psychosocial aspects of genetic disease and how we take patient reports of their own experience and incorporate that into clinical trials and into different studies.
Could you define what we mean when we say the psychosocial aspects of genetic diseases?
That's a great question. When we think about medical problems in general, us in the medical field, sometimes we think about things in terms of something called the biopsychosocial model. And what this means is there are biological aspects to living with the medical condition, and that's things like the medicines you take or the symptoms you have. There are psychological aspects to living with the medical condition. That may be your mood, your coping, the effects on how you're feeling emotionally. And there's also the social aspects of living with the medical condition. And so that may be how that medical condition affects your ability to play regular roles in life, how it affects your ability to work or go to school, how it affects your ability to play roles in your home, in your family. For instance, are you able to cook for your family? Are you able to play with your kids? Things like that. And so when we think about the psychosocial aspects of genetic disease, we think beyond the medical things, which of course we want to learn about and we know a lot about, and a lot of people are researching that. But we think beyond that to say, how does it affect a person's life day to day beyond the medical?
Could you describe some of the psychosocial aspects of the genetic diseases that children and teens may experience?
That's a great question. So when it comes to living with a genetic disease, as you might imagine, there's many aspects to that experience, not only medical and clinical, but also the psychological aspects. For children and teens experiencing life with a genetic disease for themselves or maybe for another family member or a loved one, they may experience senses of isolation, feelings that people don't understand them. They may feel a burden that they have to explain the disease to everyone that they meet, and that may be difficult for them. They may feel like they have to be a representative of the condition, or they may feel things like trauma or stress from having to be around that condition a lot. So there's a lot of things that can go into the psychological aspects of living with the genetic disease or living with someone that you love who has a genetic disease for children and teens. Of course, those are the negative aspects. There can also be positives. And, there's been studies that show that people say having a sibling with Down syndrome, for instance, made them a better person, made them more compassionate, made them more positive. And so there's both negative and positive, but we have to be mindful of both of those aspects when we're caring for our patients.
Can you tell me about your work and outreach in this area through creative writing?
Thanks for asking about that. So way back when I was in medical school, I went to medical school at Baylor College of Medicine. We had a lecture, actually I was part of an elective called Compassion in the Art of Medicine. And during that elective, we had lots of different speakers come and describe beyond, the medical aspects of medicine, the psychosocial aspects like we just discussed. And so during that lecture series, somebody named Rick Guidotti came and spoke to us. And some of you guys may be familiar with Rick Guidotti and his work. The brief story is that he is a former fashion photographer who was very successful. He was photographing models, runway shows, things like that. And at one point, he, by chance, saw a child with albinism on the street corner. This was when he was living in New York City, which he still does, but in New York City. And he saw this little girl and he thought she was very, very beautiful. And he really wanted to photograph somebody with albinism because he thought it was such a wonderful example of beauty. But when he tried to catch her on the street corner, he couldn't catch her. And then after that, he said, okay, let me look up pictures of people with albinism. So he went to a bookstore and paged through some books and found really not humane representations of these people with a genetic condition. And he thought, these people are so beautiful to me. Why are they being depicted in this way that really doesn't reflect that beauty? And so based on that experience, he started photographing people with different genetic conditions. And that's become his life's work. He has a nonprofit organization called Positive Exposure. They do all kinds of different things, including still photographs of people with genetic disease, but they also do different events. They do educational materials and all kinds of stuff. So it's a wonderful organization, wonderful website worth looking up. But when I heard this lecture, I was so inspired by the work that he had done. He took something that was an art for him, something that he really was passionate about, and use it to help other people. And so I tell you all that information because when I heard that lecture, I thought about my own artistic passion, which is writing. I was an English major in college, and I write personal essays and publish them. And, I said, this is something that I feel that I'm good at, that I have an experience in, and I know that helps me. So I said, why don't I use this to help kids living with genetic conditions to express themselves and to feel empowered? And so working with Dr. Lori Pataki and Susan Fernbach, who are both wonderful folks also at Baylor, I created a program called Get It Right, with the right being WRITE, like right, where we had children with genetic conditions, either they themselves or an affected family member, come to workshops that we would do, every couple months or so, and we would pair them one-on-one with medical students to write about different aspects of their lives. And I never formally asked them to write about their genetic condition because part of the purpose of the workshop was that they didn't have to talk about it. They were in a medical setting, sort of, but they didn't have to talk about the condition. We don't want to make it about that. And through that experience, we learned so much about how these children were perceiving their experiences living with genetic conditions. And it was just a really rewarding experience, seeing the connections that were being made between the children and the medical students, and just seeing how letting people write about their own experience made them feel empowered.
What impact have you seen or measured through your outreach with children and teens with genetic conditions?
So in my previous experience with Get It Right back in medical school, we didn't actually do any formal measurements. There are formal measurements out there where you can measure, health-related quality of life or coping or anxiety or stress. And I'm getting more interested in those in my research work now. But back then, we didn't use any of those measurements for our patients or for the children we worked with in Get It Right. What we did was we just heard what they were talking to us about. And so I remember anecdotally, there were some, at one of the gatherings, we had a lot of children with Turner syndrome, for instance. And when we asked them to share something that was special about them, we didn't ask them to write about the condition or anything, but a lot of them chose to write about the condition, and they chose to write about it in a positive way. And so one little girl said, because of my Turner syndrome, I have to take injections. I think it was maybe hormone injections, I'm not sure exactly. And those injections, she said, me learning how to withstand those made me really brave and special. And so I felt like that's special about me. And I think another one stood up, and if I remember correctly, she said that, having Turner syndrome made me meet a lot of other really nice friends. And I'm really grateful for that. And at one point, one of them got up and hugged the other one who was speaking. It was really, really heartwarming. So those kinds of things are the things that we experienced and saw firsthand. And we actually got the chance to write up our experience for the American Journal of Medical Genetics. And it was published back in, I think, fall 2014. It was just kind of not an op-ed, but just an experience piece about what we have experienced and saw. And there was impact both on the students or the children, but also the medical students who volunteered with us. And so you can read all about that in that paper. It was by myself, Dr. Pataki, and Susan Fernbach. So it's out there. It's really interesting stuff that we saw.